Hi, I'm Dr. Chuck. Today we're going to be talking about genetics versus lifestyle. Stay tuned on Your Filthy Mouth.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn, and this is Dr. Chuck, the star of the show. And we're here to talk about your filthy mouth and how it holds the key to your overall health.
Yeah.
So today's topic is about genetics versus lifestyle, who we can blame and who we actually have to blame, for some of this. So let's jump in. You know what, before we do, let's ask you to subscribe. Just click the button so you don't miss any episodes that come up because they are so cool. They're so good. All right, Dr. Chuck, what exactly do you mean by genetics versus lifestyle, first of all?
Well, it's interesting. People a lot of times want to say, gum disease runs in our family. We've always had this, or we always get cavities. My parents had this, and grandparents had this, and I'm not saying genetics doesn't play a role in it, but so much of it is lifestyle. That's what we learned from our parents.
Right.
This is the way we eat. This is the way we exercise or don't exercise.
Sure.
This is the way we clean our teeth or don't clean our teeth.
Right.
And it becomes habit, and it goes on for generations.
Right. And lifestyle is the choices we make.
Yeah.
So if we have bad teeth, it could be because we're not caring for them properly.
Well, it's so easy to blame someone else. It will blame the genes. Yeah, it's been in the family. I can't help it. There's nothing I can do about it.
Right.
That's not true.
Right.
That's absolutely not
My
true.
mom didn't breastfeed me. I was giving you whatever.
You're going to find out some excuse.
Right.
You're going to blame it on somebody besides looking in the mirror and saying, "Oh my
Sure,
gosh, it's
sure.
up to me." So.
It's incredible because when you talk about how the environment we grew up in affects us, I remember my sister saying the first fight she and her husband got into when they were married was which toothpaste to buy. Well, my mom bought this one, my mom bought that one, so we're really watching. This is really deep-seated in us.
Well, we've been trained a certain way, and that's what we think that our way is the best way. And sometimes there's a better way. Sometimes the way we've been doing is not the very best. And so when it comes to oral health, whether we brush, floss, water irrigate, all that, a lot of, talk to people, how often do you brush your teeth? I've talked to people, once a week.
No.
Absolutely. And you think, really? Yeah, that's what we all do, You can't do that.
Wow.
You can't do that. So again, that's lifestyle. That's
Okay.
not genetics. That's lifestyle.
So just along the lines of watching what our parents did, my mom every night religiously used a water pick or a water irrigator.
Okay.
And that's what you do.
Yeah.
But
not
were
everybody's
watching.
like that.
Right.
And so when you look at, again, we'll get back to lifestyle, because it's not just brushing and cleaning your teeth. It's the diet that you have. It's the exercise that you have or you don't have. It's everything about your life, your lifestyle. So that's the thing that we do have some control over, and that's what we want to make sure we understand is we can control what we do. We can control what we eat. We can control how well we take care of our mouth.
So one of the big message that we're trying to share is what happens in your mouth affects the rest of your body. Is it possible, if there's a history, there's generational heart problems, can it be reversed? Can you stop this generational curse or whatever?
Well, first of all, if you're inheriting the lifestyle, if you're inheriting the lack of care for that, yes, you've inherited that. But we don't want to blame it on genetics. We need to blame it on lifestyle. Does genetics play a role? Yeah, but it's not that huge of a role when it comes to oral. So.
I was just going to say, don't you? My mind is going crazy now. Don't you find that with things that are passed down through generation, we can be the one to say it's stopping with me, whether it's drinking or eating properly or whatever. It will stop with me, and the generations, my children will not go on with the way it's been going.
It's a decision.
Right.
You've got to make that decision. No, I don't want to have the challenges my parents or grandparents or siblings have. It's a very conscious decision. I'm going to take care of this. And again, diet, exercise, 4 things. Diet, got to eat healthy food. If you can't pronounce the ingredients, maybe it's not that good for you.
Sure.
Okay. Number 2, a little bit of exercise.
Carrots. I can't really. Broccoli. I don't know. No, I'm just kidding. I know what you meant. Just kidding. What was the second thing? I'm sorry. Yeah.
Get some exercise. So number one,
Right.
healthy food.
Right.
Number two, get some exercise. Doesn't mean you have to pump iron, but it means you have to get out there and get your body moving.
Sure.
I don't know how much phys ed is in the schools anymore. It used to be a big deal, and it's
yeah.
a little bit less now. But we need exercise. It is medicine.
Yeah.
Number three is a healthy mouth. Doesn't mean a Hollywood smile, but you can't have infection going on there. You have to have an open airway so that you can properly breathe. You have to have your bite right so you're not getting headaches. There's all these things about the mouth. Then the fourth thing is your attitude. If you got a good attitude, you have a much better chance of success than if you got a bad attitude. You know, you've got the cloud over your head all the
Sure.
time.
Sure.
Well, you know, our emotions has an effect on our health. If you think that's not true, you ever woke up in a dream when you're dreaming something and you're either breathing hard or you're running,
Sure.
you're doing something?
Sure.
Or you go to a scary movie and your heart's going like crazy?
Yeah.
Well, do our emotions affect our health? Yes, they do.
I want to jump back to the point number 3 you were talking about with a healthy mouth and generational. I mean, is it possible that with a bite, I mean, if you know, that's been passed down through generations and it's caused hereditary neck problems and head problems and everything? I mean, it's not just about the cleansing. It can be about getting proper, you know?
Right. You got three main areas on the mouth besides a smile and chewing your food. Okay. You've got the infections. Got to make sure there's no infections going on, either tooth infections or gum infections.
Okay.
You've got the airway. You want to make sure that you're able to breathe good at night. A lot of people, when they're sleeping, their tongue is so big, the mouth is so small. You lay back, the tongue falls against the back.
Right.
You know, cuts off the air. You're not breathing well. You need to be tested anyway, diagnosed to see if you have any type of sleep disordered breathing, which many times is caused from the shape of the mouth.
Which is genetics, as we go back
That's
to
a
that.
part of genetics.
Right.
Yeah.
Right.
Well, unless you've had orthodontics where they took teeth out.
Okay.
They made the lower jaw a little bit smaller. The tongue didn't get any smaller. But where's the tongue go? Sometimes
sure.
it goes back. It has to go somewhere. And when you look in someone's mouth and they've got the scallop border of the tongue all the way around, a lot of times that's because there's not enough room for the tongue. It's just pushing forward to try and open up the airway.
Oh, wow.
So, yeah, there's a lot. So you've got the airway and also have the bite, the third thing. The way the teeth come together. If your teeth, if your tires are in alignment on your car, if your wheels are in alignment, you're going to get nice even wear on the tires. But if they're out of alignment, you're going to wear the tires prematurely.
Sure.
The bite is the same way. If you got the bite the way it's supposed to be, things can last a long, long time. If it's not right, you're going to be breaking teeth. You're going to have toothaches. You can have neck aches and headaches and all that, just from the bite.
Interesting.
Make a difference.
So as we're talking about genetics versus lifestyle, I mean, we kind of pounded that lifestyle, there's no excuse, you know, and genetics, if you think that, well, I was just born this way, I was just born with my teeth like this, or all our family, my grandmom even had crowding.
We have soft teeth. I've heard that so
Okay.
many times. We have soft teeth.
Right.
And I have a hard time with that. There's a small percentage of people that maybe they do have some genetic issue with soft teeth, but that's the exception. That's not the rule.
Okay. We're always looking to blame somebody else. It's so much easier if it's
It's
what
not
really
my fault.
is my fault.
Yeah. And I think sometimes we just need to look in the mirror.
So as we're talking about genetics versus lifestyle,
Mm-hmm.
you've seen thousands of patients. Do you have any success stories that gives us hope?
Oh, there are a lot of them.
Yeah.
A lot of them. There's one particular situation where this woman's mother and sisters all died in their 60s because of cardiovascular disease and diabetes. And she decided that she was not going to follow the same thing. So it'd be really easy to say, well, it's genetics. They're all doing it.
Sure.
But what she did in her 30s, she changed her lifestyle completely. She started eating healthy food. She started exercising. She took up golf,
Okay.
and she got pretty good at it.
Yeah.
Her son was a dentist, and her son made sure that her mouth was healthy on that. All of her sisters and mother died in their 60s. This lady she looks fantastic. She's 93.
Wow.
Still plays golf.
Oh my gosh.
Still is watching what she eats. So this was a lifestyle change that did it override the genetics? Well, maybe the genetics was there, maybe it wasn't, maybe it was the lifestyle. So
Wow.
we've seen successes. Yes, absolutely, and that's what we want people to understand is you've got way more control than you think you have.
Man, that story, that brings it home.
Yeah.
I mean, mic drop. There's nothing else to say.
Yeah.
We can change it. We can change it. We have
You've got the
control.
power.
Yeah. Yeah. All right, we're going to come back with the question of the week.
Here's Dr. Chuck's question of the week.
Okay, we're back to Your Filthy Mouth, and we've got the question coming from Tom today.
Okay.
And he said that his wife often tells him that his breath is bad.
Okay.
And sometimes it's really after he just brushes his teeth, too.
Okay.
And he asks, what's up with that, and what can he do?
Well, there are several things that can cause bad breath. The number one is periodontal disease, gum disease, the bacteria in your mouth. But if you're diabetic and you're in ketosis, or if you're on the keto diet, and you can have bad breath, yeah, because it's acetone breath coming out.
Okay.
But most of it is caused from periodontal disease or gum disease. And they've actually got one thing you can do about it is you can have the bacteria in your mouth tested. You do a saliva test and you find out exactly what bacteria you have in your
Really?
mouth. Yep. And then they can come up with an oral antibiotic rinse. So you don't swallow it. It doesn't kill the bacteria in your stomach, but it's an oral antibiotic rinse. You take it at the same frequency that you would be taking antibiotics anyway.
Okay.
And usually within a week or two, the bad bacteria are gone. The breath is better. You're feeling better.
Wow.
So there, a lot of times it's from gum disease. Now you have to have your teeth cleaned. You got to get
Sure.
the bacteria out of
Sure.
there. You got the food particles, the tartar, calculus out of there. You have to get that clean. But a lot of times it's gum disease, periodontal disease. Which remember, periodontal disease is the bacteria in periodontal disease have been shown to be causative for cardiovascular disease. So if you get someone with bad breath, it's not just the breath that's the problem.
Right.
There's a really high probability they have some other things going on in their body. That's just like the red light on your car coming on. You got bad breath? Let's check it out. Let's see what's going on.
So if you're a nurse and you're caring for patients and you smell bad breath,
Yeah.
it's way more than just, oh, that's offensive. It's maybe that's part of the reason why you're in my hospital bed. you know?
Absolutely. And this is where we need to, rather than walking away from the person with bad breath, we need to go out and find out, why do you have bad breath? If it's from gum disease, could that be affecting other parts of your body? Oh my gosh, absolutely. Let's connect the dots. The mouth is part of the body.
So this, let's go back to that, the rinse. Just every dentist is able to do that, or do you have to just call around?
No, you have to find a dentist who does saliva testing. Not
Okay.
all dentists do it. Again, that's why one of our episodes we talked about how do you find a good dentist,
Right.
and that's one of the things you're going to ask. Do you do saliva testing? Do you check my bite? Do you do gum probing? Do you do what? Ask them what all they do.
Wow.
But yeah, the saliva testing is this is just for the last several years that it's really catching on. But if you know what you're fighting, you can fight a whole lot better. And that's it. If you know what bacteria you have in there, now you can zero in on that and just knock them out.
Amazing.
Yeah, it's come a long way.
And if you've got a question for Dr. Chuck, you can go to yourfilthymouth.com, actually click on the computer, the record button to ask it, or email in just like Tom did today. And today's topic was about lifestyle versus genetics.
Yeah.
And what are the takeaways from that?
Well, number one, you've got to realize that the situation you have might not be because of genetics. It might be because of lifestyles. You need to really evaluate, is it really genetics or is it my lifestyle? Am I doing all the things I know I should be doing, or am I just skipping them?
So you're in control.
You're in control. That's the number one, is you're in control. So
Now, the second point, take full responsibility.
you've got to. You can't leave it up to your dentist. You can't leave it up to your physician. You can't leave it up to your auto mechanic. I
Right,
mean, you've
right.
got to take some responsibility.
Right.
And this means spending a few minutes every day, 5 to 7 minutes, one time a day. I would rather see someone spend that and properly clean their mouth one time a day right than 2 or 3 times a day wrong.
So before we jump on to the third one, you mentioned auto mechanic. That's like getting mad at your auto mechanic if you don't get regular oil changes. Why did my engine blow up? Well, you need to take responsibility, make sure you maintain it.
And that's an illustration or an example we use all the time. I
Yeah.
mean, you can either change the oil or replace the engine. Which would you rather?
Sure.
Yeah.
The third takeaway is to just do it.
Just do it. Today is a good starting day. Today you can go ahead and you can say, look, it's time for me to switch the way I've been doing things, or to improve on what I've been doing in the past. I've been doing it, but maybe not enough.
Sure.
And then follow up with a dentist, with a good dentist. Find a good dentist, get yourself in control, get your mouth good and healthy, and just do it. Like Nike says, just do it.
And under that just do it are not just taking care of your mouth, it's eating right and other aspects, right?
Got the 4 things. Your diet, whatever you're eating. Number 2, a little bit of exercise. Doesn't mean you have to pump iron, but you got to get out and move a little bit. Number 3, a healthy mouth. Again, doesn't mean a Hollywood smile, but you can't have any bacteria. You got to keep it healthy. And number 4 is your attitude. That plays a role in our health, our attitude. We don't like to think it does, but it really does.
Doggone it, what do you mean by that? All right, well, that was great. I loved it. Genetics versus lifestyle, that was the show for this week. We're glad that you're here. Don't forget to subscribe because, well, we'd love for you to come back for each show. And also tell your friends and family about what we're sharing.
That's what we're trying to do. We want to spread the word. This is not about us. This is about you. We want you to tell your friends, your family, sometimes even your dentist, hey, did you know about this? And again, we're just trying to help people be healthy. We've got a healthcare crisis in our country. And if we keep doing the same things we've always been doing, we're going to keep getting the same results. It's time that we started connecting the dots and doing something different.
What happens in your mouth is affecting the rest of your body.
What happens in Vegas may stay in Vegas, but what happens in your mouth goes through the whole body.
We'll catch you next week.
Yeah.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.